What exercises should I do and or avoid? That is a great question. That's one of my favorite questions of this series. And the idea is that we need to do exercises that encourage our body to release the tension or increase the muscular stability of whatever joint is bothering us. For the most part, with physical therapy, we're dealing with people that have issues that are going to be with joints. And we're looking at how we can stabilize those joints, how we can mobilize those joints by activating the structures around them. There are some things like frozen shoulders and things like that where it's going to diminish over time what you're able to do until you're in that thawing phase where you're going to increase the motion that you have, that where you have a tissue that can't really be manipulated very well if you're in that freezing stage of the frozen shoulder. But most of the time what we're going to try to do is we're going to try to do things that are going to activate and are going to increase the overall pliability as well as stability and strength in those tissues. So we often feel like that what we need to do for something that's tight is stretch it, but it's not always the case that it needs to be stretched. Often something is tight because it's weak, because it's spastic and it's not working well, and so therefore it tightens down, and what we need to do to loosen that is strengthen it. We need to get it activated more. Often I'll talk to people as kind of thinking about neuromuscular activation as a bit like a light switch. Like, you know, if you had a light and it was flickering, the first thing you do is walk over and turn that light on and off. That's the equivalent of if you have a muscle and it's spasm and it's tightened down, that you turn that muscle on and off, and it helps to release some of that tension that it's having, and it can help make it stronger and more stable. So a lot of what we do in therapy is actually to perform in a controlled manner the exercises and movements that actually agitate your pain. Maybe we don't fully agitate the pain. Maybe we go just on the cusp of it. Maybe we move into discomfort. So when we talk about discomfort, we're like looking at a pain scale and we're saying like a 4 or 5, a 3. We're not talking about a 7, 8, or 9 type pain. We go into some discomfort, and that helps us to actually, get things moving a little bit and to relieve that pain. I mean, there's guys on YouTube like knee over toes guys that make a career out of the fact that avoiding the thing that causes you pain often just causes you more pain. You have to, graded exposure to that is going to help to increase your stability and make you stronger in those ways.